question we were asking was, would taking a once-a-day drug of rivaroxaban prevent blood clots from happening while patients are on systemic therapy, including chemotherapy or targeted therapy? The patients included in Cassini were patients with all solid tumors or lymphomas. We excluded patients with primary brain tumors, brain metastases, or other hematologic malignancies. They had to be patients at high risk for getting a blood clot. So we defined risk based on a score that my research group had previously developed, known as the Khorana score. And we took patients with a Khorana score of 2 or higher, and only those patients were included in the study. Additionally, we did lower extremity ultrasounds before starting patients on the trial, and we wanted to make sure that there was not a blood clot already present. And in this high-risk population, we found 4.5% rates of blood clot already present before patients even started on treatment. So those 4.5% patients were not randomized, and then the other patients were randomized, and then we followed them to see if they developed blood clot or not over a 6-month period. The primary endpoint was a combination of different types of venous events, including screen-detected events. So we did screening ultrasounds of the lower legs every 8 weeks while patients were on study, but we also waited and see if any symptoms developed and patients became symptomatic, then we would test them as well to make sure that they had a blood clot. During this time frame, about 8.8% patients during the 6 months developed a blood clot, and that number was reduced on the rivaroxaban arm, but it was not significantly reduced for the 180-day period because about 40% of patients stopped taking the drug for the full 6 months. So they took it initially, but they didn't take it for the full 6 months. And 40% of events happened after patients stopped taking the drug. We had pre-specified an analysis known as the on-treatment analysis. So while you're taking the drug, does it reduce the risk of blood clots? And there the results were very significant. So 6.5% down to 2.5%, so 4% absolute risk reduction. And that p-value was 0.007. We had pre-specified a combination of the primary endpoint with all-cause mortality. And we found that patients on the rivaroxaban arm had a 6% absolute reduction in the combination of the primary endpoint with all-cause mortality. Safety is obviously a concern when we are looking at primary prevention approaches. The incidence of major bleeding was low, under 2%, and the incidence of even non-major bleeding was quite reasonable, 2.7% or so. I think this is a large risk-adapted thromboprophylaxis trial. We were methodologically very robust. We did intent-to-treat analysis, we did on-treatment analysis, we looked for all kinds of adverse effects. And overall, the findings suggest strong clinical benefit to cancer patients as long as they take the drug without strong concern for safety. There's a second clinical trial looking at the same population, so Khorana score 2 and higher, also solid tumor patients. That trial is supposed to report out very soon over the next several days. If the two trials confirm the same findings, then I think we may be moving the landscape of, because right now we are reactive, we manage the blood clots when they happen, but we may be able now to move to a preventative phase, which would be a big advance for cancer patients.